Hello, everyone. Welcome to Care for Lives launch and networking event. First, we have Dr. Ben Stein, CEO of Adomo, experienced emergency physician, a healthcare startup, executive with multiple proven high visibility successes. Oh, see, I gave that good intro. Then we have Ms. Alyssa Rosenberg, founder, CEO of Nursing Navigation Services, respected and revered by many plastic surgeons for her care of patients at home post-surgery, a nurse over up years. I am not giving her age. Then we have Irene Joseph, CEO of ILS Care, regulatory compliance consultant, helping hospice and home health agents stay compliant, audit ready, and survey ready. Just one more hand of applause. And my name is Vanessa Chambers, if you haven't met me for the name. I am the CEO of Care for Lives, a concierge care management group, and I'm your moderator for today. I would like for you guys to please, can you share your thoughts on the current landscape of home care and why it's becoming increasingly important for accessible health care in America?
I'm seeing that there's a lot more patients are aware of it or asking more questions about it. You can see it a lot more in the hospitals being offered to some patients. So specifically home health itself. If a patient has Medicare and you go to the hospital, you get some sort of any type of surgery, it's usually automatically offered to you.
People want to stay at home. That's where they want to get their care. Certainly the folks that are immobile or somewhat immobile need to get their care at home if they are to stay there.
Future of home care. In your opinion, how does home care fit into the future of healthcare accessibility, especially for underserved communities?
So if we could get specialized private companies to sort of supplement with government agencies, it would really be helpful. And as you also stated, there are funding for that. You know, a lot of this is private pay when you hear concierge or private care, but there are supplements and there are sliding scales that people work with that could really help underserviced communities, and I think that needs to be expanded.
Hospitals are really inefficient, and the costs for keeping someone in a hospital and the cost for paying for an ambulance to take someone to the hospital, to be seen in the emergency department, to be admitted at times, and then to be taken in an ambulance back home, hopefully in a short period of time. There's really an opportunity to treat patients in the home, even underserved, in a cost-effective manner when applied to the right patient populations. I think I was talking with someone earlier about the challenge is sort of want versus need. You provide good service in the home, and guess what? Patients want you to come more and more to see them in the home.
Having the ability of having home care in your home and to see if possibly some of this insurance company or even the underserved community, if at a lower cost, something that that could be provided to them, I think that would change the whole healthcare landscape.
Home care is more than just for the elderly, really introduces all age groups. You know, the conversation gets very, very differently from a 75-year-old person talking about home care and a 30-year-old person talking about home care. So what are some key barriers to making home care more accessible?
We have to find a way or a program that home care visits can be covered, and it doesn't always have to be private pay. And I think that is expanding, and I think there is programs, but I think people are not aware of them.
There's really an opportunity in working with third-party payers, Medicare and others, to understand that, yes, it costs a little more to bring someone into the home for this encounter or for this period of time, but the cost savings in keeping that person out of the hospital and preventing complications, in avoiding ambulance and ambulette transfers back and forth, in avoiding readmissions, there's a real cost-saving opportunity.
How can we better empower patients in the development and execution of their goals? And what role does education play in this?
You have to make sure that your patient understand, the family understand what is happening to them, instead of, because we go in, even in a hospital, you're being discharged, you get a list of check off, don't do this, don't do this, don't do this. But a lot of times they don't understand the why.
Focusing on post-care is also important, but post-care I think was always there. It's always about the post-op instructions. So kind of focusing on the pre-op instructions I think would be.
I spend a lot of time, because my worry for me as a concierge nurse when I used to do it, is that my fear was always, when I leave, how is this patient gonna be able to take care of themselves?
And we got to demonstrate. So it's kind of, it's a long process sometimes for some folks, but it's a constant reiteration.
I allow them to videotape how everything is done, and then they could take pictures, because if they have something, a visual is much more helpful to some people than just written word or verbal instructions.
Why is family education critical in providing quality home and healthcare services?
But with post-surgical patients, they're coming out of anesthesia, they might still have some pain issues they're working with. They're not really focusing on what's going to happen for the next 5 to 10 days.
From the beginning, we do ask you who's gonna be your primary caregiver and include them into the care plan.
And how can this reduce healthcare costs in the long run? But now we have all these different resources, all these different avenues that we can try before we go for those more expensive costs. And I tell you, in the hospital, you stay one day, and that's your whole salary. What role do you believe AI will play in the future of patient care?
I personally think it's gonna change the way doctors, nurses, the way we care for our patient. Because think about it, right now, you're able to have a conversation with it. In mental health alone, I think we could do a lot, because I've seen how the young kids are having conversation and it's responding as if it's in person. So think about if a patient is home and it's connected to the doctor's office, and then they say, these are my symptoms, this is what I'm feeling. And AI can then direct the doctor and can pinpoint exactly, she's on this, she's on that. And why don't we try to test for this? I think it would help doctors, nurses, home care agencies, home health hospices.
It's a very important tool to use, but I think it needs to still stay as a tool. I think a human eye needs to oversee that, and I think for my patients, emotional support is really important. It is for most patients, and I don't think you're really going to get that. Yes, it'll go through the noise, you'll get the facts, it'll be quicker, it'll be helpful, but even for home care, I think there has to still be, we have to put in the human touch, and there has to be contact in that way.
Don't worry about being replaced, just worry about being left behind. Because if you don't go with the flow, it will do that. It will leave you behind. In your experience, what has been the benefits of virtual care?
There are people in rural areas that it takes them 2 hours to get somewhere. And if they could reach one of us, a concierge nurse, a concierge doctor, to just get some information, some guidance, and it's just a telecall or a face-to-face or even FaceTime on your phone, which is super easy, I think that would be really helpful, and I think it has been helpful.
So I think accessibility is really gonna be a huge change the way healthcare happens. That first visit with your physician should really be in person.
So that's really helpful for people, to see other types of doctors and different nurses, different opinions, cities, rural.
I think the key for telehealth is going to be, and really for all of in-home care, is being sure that it's integrated into your primary care relationship.
Post-surgical care in the context of plastic surgery.
A lot of our doctors, for certain procedures, require a 20 to 24-hour nurse to be there for risk of hematoma and other complications that can arise, to have, on-site view of that. A lot of people decide to extend out for 2 days.
One key takeaway, so everyone got to answer this one, you would like our audience to remember regarding the future of home care and its role in enhancing overall health and wellness.
I just want more people to be aware that it is accessible, and it's not only monetarily accessible. And I know I work in plastic surgery, it's a very high-end situation, but there are ways, and there are organizations, and there are people who are willing to do pro bono work for people. It is out there, and there are programs out there through breast cancer awareness, through other organizations, that you can get private nursing to help you and advise you, and especially to advise you. The one-on-one might be a little bit more difficult, but there to get advice, to go into a group setting, to get support, it is out there, and it is out there to help you in your home. So
For me, it's to make sure when you are visiting your doctor, right? One way that you can use ChatGPT is prior to your visit, tell them to put together your symptoms, anything that's happening with you, and have questions ready. And part of that question is you can ask, can I have a nurse? Because a lot of doctors, you'd be surprised, do have nurse practitioners that can come and visit or even call you.
Healthcare has really been aligned around the interests of insurance companies and large health systems. And really what it needs to be, and what it should always be, and ultimately what it is about the needs of the patient. And I think home care is really a movement towards recognizing and accepting that the patient should be the one where that healthcare revolves around. I think it's coming, but I think we're going to need companies like Care for Lives and others to help us shepherd the way.
Round of applause for our panelists here.